Hello and welcome to The Table, a new discussion show from Byline TV where we get to the heart of the issues that matter and have the conversations no one else is having. Tonight's show is going to be a little bit different from normal. Usually we'd have commentators and broadcasters from the left and the right come together for a productive debate about something in the news. But tonight we're talking about the NHS and what is going wrong with it. Why is it struggling? Is it really being privatised? And who better to talk about this than with people who actually work in the NHS? They can answer all my questions. So that is why I am joined tonight at the table by three doctors. They are here in their own capacity as individuals. They're not representing any particular organisation or body within the NHS, but each of them is here because they believe in the importance of this conversation. So, without further ado, let me introduce you to them. We have Dr. Dan Goyle, medic and researcher, Dr. Sonia Adesara, GP, and A&E Dr. Andrew Mayerson. Right, let's get into it. So firstly, thank you for giving up your time, because I mean, getting this lot together, honestly, getting like doctors, finding when you're not on shift is quite a feat, but we've managed to do it. So I think the reason I wanted to have this discussion is because the NHS is something I'm quite passionate about. I've lived all my life, and I'm into my 40s now, well into them.
Can you tell?
Oh, I know, thank you. But the point is, I've always had this privilege of thinking, if something happens to me or someone I care about, you just pick up the phone, right? And help is there. That's how it's always been. Now, it feels to me that that is a bit under threat. And the more that I talk with different people on different sort of TV shows and everything, but not doctors, you hear things. And I think, is that true? Or are these just myths? Or are these just tropes? So let's get into it. These are some of the things that I hear. I hear that the NHS is overfunded, it's bloated, too many managers, too much bureaucracy. I hear from some people, migrants. There are so many migrants in this country that they put a strain on the NHS. I don't believe that to be true. So that's, let's just start. Dan, let's start with you.
I'll take the managers one, if you like.
Yeah, go with managers.
It's quite a straightforward one to blow that one out of the water. I mean, all of these talking points that the Tory party and their supporters put out there is just to try and escape the fact that they are grossly neglecting the NHS. I mean, to levels that have never been seen before. And it's becoming very brazen. You know, we can clearly see the funding is declining. We can clearly see that instead of investing money during the pandemic into the NHS, they're investing it to their mates who did a bad job, didn't help the NHS at all, or the public. And these kind of little tropes about management being over-bloated, fact remains NHS is one of the most efficient services in the world. Even now in crisis, we spend less on managers and admin than most other comparable nations. Mm-hmm. So it's a distraction, it's some noise. What we want to hear is, you know, why aren't you funding it? Why aren't you doing anything about this crisis? And bearing in mind, we have Scotland that are doing something. Mm. So it's very easy to compare the two. And currently just now, Westminster's not looking good.
So deliberate decision, do you think this, is this because they are trying to privatise it, or sort of to cushion us up for that, so it gets to a point where the NHS just simply isn't functioning, so it's the only option? This is just a theory. I would like to let's put it to you, Sonia. What do you think?
So I think when people say there's too many managers in the NHS, I think it's just a dim comment. You know, it's the NHS is a massive institution. It's one of the biggest employer in Europe. Of course, you need management for it to run efficiently. So it's just a dim comment.
Good, we part that one.
Dim comment. Dim. I also think the migrants are the reason why the NHS is failing is also a really stupid comment. I think anyone that's used the healthcare service, that's been into any hospital, that's been in the care sector, will know that our NHS would fall to the ground if it wasn't for migrant workers. Sure. And that's since its inception. So when the NHS was built, we actually had governments, the governments go to the Commonwealth and ask doctors to come from India, nurses to come from the Caribbean. We have, throughout the history of the NHS, we've actually relied on migrant workers to keep the NHS going. And just a further point on that, migrants are charged to use the NHS, and they charge that a significant cost. So let's say if you are a pregnant woman, having your maternity care with the NHS can cost anything between a few £1,000s to £10,000-20,000 if there's any complications. But we know that actually the cost of those charging mechanisms, the cost that costs the NHS is more than the amount of money that can actually be brought in.
Yeah.
So this argument about migrants, taking money away from the NHS is completely false. But we know that this argument is used, I think, politically to try and, I guess, demonise migrants. And there is a negative impact of that. There are many migrants living, in our streets who, let's say, when they need the health service, don't use it because they're scared. They're scared of the repercussions, and also there has been under the Conservative government's increased links between the NHS and the Home Office. So people are too scared to use the healthcare service because they're worried that it could lead to them becoming deported. I had a case of a gentleman last week. I found him on the street. He was really worried. He was a man from Brazil. He was homeless, living with, and his child was unwell. And I said to him, "Come into the GP surgery. Come in. Let me talk to you." He was too scared to come in because he didn't have status, and that's the risk here. And then we know that people harmed. We saw this in COVID. People died. Migrants died because they're too scared to access a healthcare service. We don't know the true numbers, but the one thing that is recorded in this country is maternity deaths, and we know that there are women that die. Because they are migrants, because they're too scared to access care. So there's a real life cost of this narrative around migrants are using our NHS,
so,
and we need to be hard on immigration.
Narrative and not true anyway. And of course, the vast majority of migrants also are paying tax.
Yeah, and they have to pay a health
to the NHS.
Yeah, and if you're an immigrant, you could be working in the NHS, then you have to pay to use the NHS as well.
And then getting abused.
And then you get abused, and you get abused, and then you get abused within the health service as well, and you get abused online. So it's a pretty sort of disgusting hole that we've got into with this now.
Well, I'm glad we've got rid of that one straight from the top. Now, you guys are at the coalface every single day, working in the NHS. Has it got harder lately? Stupid question. I know you've had the pandemic, which has been horrific and scarring, but you tell me, Andrew, translate for us, like, the difference between your job 5 years ago and your job now.
Well, it's a very good question to ask me because 5 years ago I was not a doctor. I was a migrant
Utterly
from the United States. I was in medical school.
Yeah.
I was paying American tuition to be here.
Okay.
And so bringing money into the economy, and just thrilled to be able to have an opportunity to study medicine in an incredible health system. I come from the States where we do not do healthcare right. Where after World War II, we made a decision to go with private healthcare that's obtained through your employer, and then you guys decided to do something very, very different.
Yeah, that was
properly fund it, and create the NHS. And it's just you look at the difference. 10 years ago, the NHS in the United Kingdom was ranked the best healthcare system in the entire world, #1. So many different ways. And there's this chart that I will share later that I love from the Commonwealth Fund that talks about this. And so I came from a land of doing healthcare poorly, wrong, and then I feel like this is the promised land of healthcare. And so I graduated from medical school right before the pandemic started, so I don't know what it was like beforehand. But looking at the data,
because you've come at a really fun time then.
A fun time. All I know is the pandemic. Yeah.
Oh,
so these guys give you a little better sense about that.
We apologise, Andrew, for your lack of training and for all the craziness that's going on just now. I mean, 22 years I've been qualified.
Okay.
And as Andrew says, in 2010, we were doing well. I mean, my God, were we doing well? And it was a service to be proud of. You could do your good work. It was busy. I mean, they've always squeezed more out of us than you would in a private sector because of that ethos that we have. Andrew, for example, is in FY3. He'll do 10 hours per week of overtime unpaid. You're a GP. I don't even want to know how many hours you're doing overtime. That goodwill that we run the NHS on has started to drip away. Yeah. I mean, and we just don't have anything left. over the last...
because people are physically burnt out because of the pandemic primarily?
To be honest, the pandemic was an odd thing. I mean, it was surreal, it was scary, but actually, I would say the last 18 months have been non-pandemic work has been far, far heavier and more sucking you dry than, because the demands are definitely up, the complexity is up, staff shortages, and also this general sense that you're not actually that valuable. You know, management, executives, government, you know, you're just a bum on a seat. And people are getting fed up, and we're tired. And being 30% lower pay in 10 years at real terms doesn't help.
No.
Yeah, and I think also, you know, yes, the pandemic made things worse, but I think, you know, I've been working in NHS for about 10 years, and I think over that time, things every year it's been slowly getting worse. And actually, before the pandemic, I remember the winter before, you know, that winter just before COVID hit, that was an awful winter in the NHS. So I think, you know, it's easy to blame COVID on the state of the NHS, but actually it was getting bad. And I think that morale being low, I think it's, you know, I don't think it's maybe not so much, there is an element of, you know, burnout, there is an element of feeling underappreciated, but also I think people, and I think this in general practice particularly, the reason why GPs are leaving, I think it's because people feel like they're not giving good care anymore.
Yes.
And I think that's difficult. You know, I was like, you know, I left work today when one of the admin staff said, are you okay? And I was like, yeah, I'm fine. And I was thinking, actually, no, I'm not. I'm angry. Because I just had so many conversations today with patients where I'm angry at the bad care that they're getting. Like, I'm angry that I'm referring someone to hospital knowing that they're not going to get seen for 6 months and knowing that they're going to become more sick and disabled as a result. And that's quite difficult as a healthcare professional.
I think that is the hardest thing.
Yeah, we're used to working hard. And actually, most of us, you know, we go into the profession because we enjoy it and we want to care and we enjoy working in the NHS and we enjoy what it stands for and we believe in what it stands for. But when you know that people are not getting good care and you see it in your patients are getting understandably angry and feeling let down by the healthcare service, that affects, I think, the morale of healthcare workers.
I can only imagine. I'm sitting here I'm quite an empath feeling on your behalf. It must be absolutely soul-destroying. What about in A&E? I mean, how do you do that? Where do you start? It must be so busy. Well, and when you're short-staffed.
Yeah, and that's the thing is you see the waiting rooms just get larger and larger and larger, and you see when there is a huge number of people that are waiting there, it gets more stressful for the staff members that you're working with. People are shorter with each other. There's just this overall sense of stress and anxiety is increased. Patients are getting more and more frustrated. Yeah. And I was assaulted by a patient in the hospital at some point, and earlier in the spring. And I think that many hospitals throughout the NHS, many A&E departments are instituting body cameras because of that, because there's an increase in violence against NHS workers.
Shameful.
And that's a direct result of longer waiting times, of fewer staff members, of just the stress on the system. And you can understand that it gets more and more frustrating. Oftentimes it's the worst day in a patient's life is having to come to and wait in A&E, and they were in terrible pain and then waiting hours and hours and hours for care. It's an awful experience for them. And
they end up taking out on the people who are doing their best with not enough resources and not enough people. So this is a vicious cycle, though, because then people will hit a wall and go, I can't do this anymore, and you lose another member of staff. So, this is easy to grasp. So, listen, I know that there's been little elements of privatisation. You can't put it all at the foot of the Tories. It perhaps started... back in the day with sort of Thatcher introduced, I think it was opticians and dental, but certainly Tony Blair as well, and John Major before that, and so on. But we are where we are now, and it seems particularly bad now. Could it be, in your opinion, turned around?
I certainly think the services could be recovered if we had a government that genuinely cared about the people and put their priorities first. It looks like we're
stuffed then.
We're gubbed.
Just give up now, shall we? Don't get ill, anybody.
Move to Scotland. We are doing a bit better up there. Our government, whatever way you think of them, they are definitely prioritising patients. It's a very good example. the COVID recovery fund. So the Tories have put 6 billion in. The Scottish Government an equivalent double, which is $1 billion for us. The Tories are putting half of that money to industry, like tech companies, to the private sector, to reduce the waiting lists. Virtually nothing to GPs, nothing to urgent care, nothing to mental health. On the other hand, Scottish Government are putting double the amount in, and most of it's going to GPs, urgent care. 10% of it's going to mental health.
Where it should go.
And we're still doing diagnostic hubs. We've actually opened 4 of them already. And still, Scottish Government, 600 million they gave. I'm not a big supporter of the Scottish Government, but they are doing well. 600 million to a winter fund, where they're saying, look, recruit and retain your staff. Here's some money to do it. What did the Tory government do? 500 million, which is proportionally much less, 10 times less, and they're putting it into social care. Now, social care needs money. There's no question about it. But it seems to me, if you follow the pattern of funding of this government, they are allergic to doing anything that may in any way strengthen the NHS. Anything, and we saw it through the pandemic. All the way through the pandemic, they didn't support the GPs. They cut the GPs out the pathway. Everyone had to phone 111 or go online. They reduced the capacity of the NHS. They put test and trace in private hands. Would have been much better.
That went well.
Do you know what I mean? And that would have been much better with the primary care would have smacked that. Just like you
Just like we did with vaccinations.
Yeah.
give them the vaccines at the best.
That was Boris Johnson.
I didn't see him giving vaccinations.
that was-
in the lab, a pet. Yeah. Oh my God.
And all the money that to the private hospitals.
And then they gave 12.2 billion last year to the private hospitals. They only hit 40% of their targets. Saw literally as many COVID patients as could fit this room.
Yeah.
It was literally, and everyone starts whining about the NHS wasting money. I mean, that was just thrown away. And Nightingales, anything to avoid strengthening the NHS. They will not invest. And you watch. The winter crisis is happening. It's going to be even worse next year. They will not do anything that may make NHS bigger or better because they want, as you said, and I think it's becoming very clear, they want it to become smaller and they want the private sector to be bigger. And they don't care that it will be worse for the patient, and they don't care that the transition to that is going to cause a lot of death, a lot of disability, a lot of suffering. I mean, it's horrible. I mean, you imagine like your grandparents sitting on trolleys because the Conservatives can't get their finger out their arse to go and do their job properly and find us the money.
They call us lazy.
Yeah, they'll fund some bankers' bonuses and they'll fund, tax breaks for the rich. And the energy crisis is bad and the cost of living crisis is bad. They found the money for it. Mm-hmm. The NHS crisis is worse. People are actually dying every week because of it. But they can't find the money.
Oh, there's money. There is money out there. You can tax corporations. You could tax Amazon. You could tax the very wealthy more. You could
reclaim back some of the PPE money.
The non-dom status money. You could reverse all sorts of things. You could find it if you really wanted to. And listen, for me, it's short-termist and actually economically stupid because, for instance, 2011 they cancelled training nurses. Mm-hmm. Where are we now? We don't, how many shortages are there in the NHS? Isn't it over 100,000?
40,000 nurses.
Yeah.
40,000 nurses.
But also, it doesn't make. If you don't have a healthy population, you don't have a healthy economy. So I have so many patients now who are on waiting lists for, let's say, a hip operation or a knee operation or other surgeries. They can't work, and I'm doing, I'm having to give them sick notes for 3 months, 6 months, 1 year because they're waiting for surgery. That's a cost to our economy. Mm-hmm. So actually, if you don't have a healthy population, you do not have a healthy economy.
This is the trick. The Conservatives talk about the economy, the UK economy. They don't mean the UK economy. Because if they did, there was the Financial Times analysis recently, for every £1 they put into the NHS, they get £4 back from the economy. So they're not interested in the UK economy. They're interested, and this is what I think the pandemic revealed for me, they're interested in the economy of them and their mates
and their friends,
and the 1%. They do not care about the economy of the UK.
No.
At all. Because if they did, the NHS would be at least, baseline funded, and it's not.
Yeah, it's very sinister. actually this conversation is kind of confirming everything I suspected and everything that I can see happening. And it's the deliberate choices that is the upsetting bit. It's not just ineptitude, it's deliberate. So traditionally, the Conservatives have been thought as sort of fiscally sensible. I mean, that's got out the window now. But it was quite interesting. Wes Streeting, Labour's Shadow Health Secretary, when he was sort of having a go at the Conservatives one day, he said it's not just that the Tories didn't fix the roof while the sun was shining, they dismantled the roof and removed the floorboards. And he was kind of echoing something that George Osborne once said about Labour and the economy. So we're not due an election for another couple of years, but who knows what could happen, what scandals could blight, I don't know. But say we don't get an election for a couple of years, and then who knows what will happen, the Conservatives could get back in, God forbid. But I need some hope. Let's say there's a change of government.
A heart attack.
Do you know what? If you're going to have a heart attack, now's the time. Because we've got 3 doctors here.
Who's leading the arrest,
It's
guys?
never been a better time to suddenly get it. Okay, so say there is a change of government. Like, Andrew, from your perspective, do you have hope? You must do. You're still turning up to work every day and helping people and, you know... Could things be turned around quite quickly? I know you say morale is sort of rock bottom.
Quickly? No.
No.
That's it cannot be turned around quickly. This is a decade-long. You know, if you want to improve the health system, you have to you can't have the short-termist thinking and funding that they're so good at. You need a long-term plan for funding. You need a long-term plan for staffing because it takes a long time to train staff. Yeah. You need a long-term plan for beds and for hospital buildings. I know that in Boris Johnson's imagination, he created 40 new hospitals.
40.
Those, another myth that we can bust, those don't exist. And
None
never
of them.
did. None of them, no.
Not one.
No, I mean, there's probably a couple that were actually planned to be, you know...
I think if they were, they
wouldn't have any staff.
They wouldn't have any staff, absolutely. But also, I think Boris would probably be living in one of them, wouldn't he? He'd be there all the time with the cameras showing at his new hospital. I've not seen one.
Yeah, exactly.
I do agree with the long-term plan, and we need that, and we're being very bad on that. I think there's a very quick fix you can do in terms of, for this winter even, if the government announced tomorrow, we will give pay restoration to staff. So just for those that don't know, 20 to 30% pay real terms drop in the last 10 years for staff.
There's 30% for doctors, about 20% for nurses.
That's right, for junior doctors particularly.
It's awful.
So a junior doctor's on about 28k, and what you're asking them to do for 28k, you know, fingers at bottoms and running about like...
Yeah, and a lot of
running bloods on a COVID ward for
to know how to put the fingers up the
yes,
properly.
Exactly. So you're asking them to do a lot for not very little.
Method.
Yes, there's gloves, But so they've got this situation where they're really stressed at work, which we are just now. It's the worst I've ever experienced it. And then they go home and they have to be stressed at home about putting food on the table, making bills. So if there's 2 stressors, they're going to choose to let go of one and go and work as a barista and get almost the same money and at least then just deal with that stress. But if the government actually do what's right and pay them more, relieve that stress at home, to be honest, I'd say probably about half of the folk that are leaving just now would stay. Yeah. I mean, because you relieve that stress, you relieve that pressure at home, and you know that if they announced it tomorrow, by next week, I think we'd already be seeing a change. And do you agree?
Yeah, absolutely. And it's not just doctors and nurses, but there's so many different staff that work in the NHS. But let's say you are, you know, like a healthcare assistant. You know, the amount that you for the work that you're doing, the amount that you're getting paid, you'll get paid more working in a bar or in a restaurant than you would working in the hospital.
Hands-on.
And they're doing hands-on,
really,
physical,
really
physical caring
your
work.
Grannies.
Yeah, it's such such important, you know, really difficult, physically and emotionally difficult work, which we really rely on, and they get paid so poorly. So it's throughout the NHS that you've got all these different people who are working in the health and the care sector that are not getting paid properly. The care sector, the turnover in the care sector is ridiculous.
And their pay is so
their
bad.
pay is so poor, and actually
Brexit's really, really hurt their staffing levels.
Yeah, and a lot of them have to have other jobs as well with it, or having to sort of access, you know, universal credit on top of their work. So I think paying people a decent wage to do work, and I think it's just, you know, I just think sometimes you've got to think, what type of country are we? You know, and it's we're happy to sort of remove the caps on bankers' bonuses, but not pay our care workers.
So revolting.
And it's what do we prioritise in this country? Care is important. You know, caring when our loved ones are unwell, we want them to be cared for, and those workers should be paid decently, paid well.
The trouble is, I think, well, we were speaking actually before this show. I was saying there's this very strange thing that where very wealthy people, it's almost like they're not supposed to care about people with less off. I was actually talking about the famous chef Jamie Oliver, who does his bit going around trying to get kids fed, and a lot of people will be like, oh, what's he talking about that for? And it's like, well, because he cares and he's allowed to and be rich. He's really, really rich, but he can also care. And but the trouble is, I think, is that the people in charge at the moment, if they get sick, they can go private.
Yeah.
It's just not a stress.
Yeah.
And they don't care about people who can't.
Yeah.
It's that basic.
Yeah. But you know what? I feel that the majority of people in this country are caring. Like
Yes,
this is
I
a very
agree.
caring country.
I agree.
And actually, the great thing about when you work in the NHS is that you meet people from across the social spectrum, and actually people do care, and that's why even when people experience bad care in the NHS, they still really value the NHS because they see those principles of kindness and care and equality really ingrained in the health service. So you know, when you said to me the Tories might win again in a future election, I was just thinking, as a country we can't do that, you know, because they've shown their true colours and they've shown that they don't care and that they're destroying the most caring institution that this country has. And I think as a country we now need to start asking ourselves what is important in this country. We are a caring country, and do we want a country where people grow old and can live with dignity? That's not happening right now.
No.
Definitely
right?
not. And I think this stat that would back that up is almost 40% of people who have cancer have to wait 2 months to be treated.
Awful.
I mean, that's been over 8 years. We've never reached our targets. I think it's over 80%. We've not reached that target in 8 years. And it's just, if you see the graph, it's just going up. And another 2 years of Tory government, I don't know where it will be. But you imagine, you know you've got cancer, you know it spreads, you know it's growing, and you know there's treatment. We've got treatment for you. We can treat it. But actually, we just don't have the capacity to do it.
Yeah.
And all, as you said, it's all a political choice.
Yeah.
This is a choice not to fund the NHS. And I'm sorry if you're at home and you're suffering and you're on a waiting list, or you phoned an ambulance, you can't get it. You need to know that this government are making that choice, and they just don't give a care about you.
Yeah, and we're starting to see, you know, you can see things on a very big scale, but sometimes it's those macro stories, and they get to you more. Like there was the little baby the other day, and it was so heartbreaking. Anybody would just be so moved by that and so heartbreaking.
Do you think they got moved? Because I actually tweeted about that. I was wondering, do you think that they got a little bit upset in the government? Did you think Sunak and Coffey and Truss and Johnson and
Steve Barclay.
Who's the health minister today?
Barclay,
Is it today? So
do you think they got upset?
No.
I genuinely don't think they did.
They would do something about it if they were. One satisfying thing was Rishi Sunak visited a hospital. Yes. That was probably a mistake because there was that lovely lady.
Oh, that was good.
Thank you, whoever you are.
You need to pay them properly. And he was like, oh, yes, we're doing our best. No, you're not.
No, you're not.
You're not. It's pretty easy. You could implement that like that, couldn't you? Yeah. Like you say, you've sorted out the bankers. Oh, my heart was so worried about the bankers.
What is the logic of increasing, just want to put this out there, what is the logic of increasing the bankers' bonuses or removing the cap for banker bonuses?
They say that it's so that they can attract the best kind of talent into the city, but actually what it means, the reason, and also it was kind of a bit of an EU direct...
Talent.
Exactly, yes,
What a concept.
That's a concept. I'm like when Andrew's going here.
Health workers are supposed to do, because they're actual angels who fly off after work.
Yes, exactly.
Their little nirvana, then they go and they drink some mead and lie down, and they don't need anything. Nope. They don't need bills. They're not
We live in the hospital. We live there.
They're martyrs.
It's on claps. We survive on claps.
It's not even like things like teachers. Why aren't they? You know, as a country, we need to be thinking, why aren't we
attracting talent?
Why? Yeah, like, do you not think the education of your children is important? Like, it's like we need to. Why is it that we have such discrepancy in pay in this country, and certain professions, particularly public sector workers,
important professions,
are not valued? And actually, you know, nursing, teaching, predominantly women, care sector as well. And I think actually maybe us as women need to be, have we not spoken up enough for us to deserve decent pay? But it's just,
when are you running?
This is reflected in schools and education as well. And we won't get there because we're talking about health, but you know, that idea that every pound you invest in a child, you get a net benefit back. Yeah. You get it actually, if you want to just talk economics, you get it back in GDP years later. You get it in health, you get it in empowerment, and you get it in so many ways from the health of a child and enrichment of a child. But no, they're not doing that either. So yes, I mean, this is, like I said, it's sort of very much confirming everything that I have thought already, but it's just been so fascinating getting all your insights. I mean, I don't know, what should people be doing? How can we galvanise people to understand what's happening to something that's so important? Or what would it look like if we lost the NHS? It would look like America, right? It would. And what happens in America? Give us an outline.
What happens in America, I will tell you. So I have family and friends who have had to declare bankruptcy because of their terrible medical bills. I have a very close person in my life who has to pay $25,000 a year now for their leukemia treatment, $25,000, and that is with really good insurance. That's a copay, and so that's the amount on top of on top of the money that the insurance company is already paying.
It's probably $100,000.
Exactly,
and they're paying 25 of that.
Yes, so they're responsible for $25,000, and so this person has the resources to be able to afford that for the time being. But then I think about, oh my goodness, all of the other people in the States who absolutely do not. And they get this disease. We know what the treatment is for it. It's available for free on the NHS, and then these people suffer because of this. It's barbaric, and that's in the wealthiest country on the planet. That's unacceptable.
So the basic difference is you can have insurance that's based on your likely need. So it's tested on your comorbidities and what likelihood you are going to be sick. And when you are sick, your premiums go up. That's private insurance. That's the state's version of it. And then, as Andrew says, you pay on top of that. So it's not just that you just have to pay insurance and you're free. You still have to pay into it depending on how sick you are. Then there's the other group, which is everybody pays. Pretty much. It's means tested often, tax-based or social insurance-based. We all pay pretty much the same thing. And if one of us get sick, then we've all got the services there. And that's the choice that we have. Now, the Tories are trying to bring more private care in, there's no question. They want it. It's $100 billion a year easily industry here. The question is, why are we not debating it? Why are we not debating it in Parliament? For that simple reason that if they brought it into debate, they would get shot down. Drastically. And you asked the question about the managers and, you know, NHS is overbloated and overfunded. It's the same thing that no serious health economist or commentator has ever said that the NHS is overfunded, because they would look ridiculous. The only people saying it are Tory MPs. They look quite ridiculous.
Daily Mail like to say it.
And then hack journalism is the only other side that will say it, and people on Twitter and social media and stuff. No serious person would ever come out with that comment that the NHS, we work so well for what we're given, and you give us a wee bit more, and we will, you know, sort it out.
And I think we have to be really careful of the narratives that are appearing, particularly from sort of right-wing media and also these sort of right-wing think tanks. And I've had the joy of debating some of their spokespeople, but their argument is, look, the NHS isn't doing well. And I think that resonates with people because people can have bad experiences in the NHS, particularly in recent years. And then they say, well, we don't want to be like America, we want to be like Europe, we want to be like Australia, who have these insurance-based healthcare systems. And that's the argument they use. And actually, I think that people are like, oh, okay, yeah, you know, Germany, you've got good healthcare. You know, it resonates with people. But I think what it forgets to say is that actually in those countries, they are paying more per head on healthcare than we do. Yeah. That's why their outcomes are better. They have more doctors, they have more beds, they have just more money significantly more money going into the system, and that's why they get better health outcomes. But secondly, I think what's missing from that debate is that with many of these countries, if you look, you do have a two-tier system. So some of these countries will have a public system that's there, but then also have private healthcare, a significant part of private healthcare. And I think we have to ask, like, do we want that in this country? Do we want a system where if you're wealthy, you can have access to better healthcare than the rest of us?
It does feel a wee bit uneasy. I mean, I was in Germany recently with a member of my family in healthcare, and if we paid privately, we would have a little bit better access to the consultant. But actually, if you just phoned the consultant secretary, they would just book you in for an appointment anyway. And then she was in hospital, my friend, and I was like, look, she's not getting great care. Can we put her to a private room? And like, a private room's on the same floor. You get a slightly better meal and you get a newspaper. And that's it. And my point is that particularly in places like Germany and France and Norway and such like, the private uplift is only marginal. And at all times, all patients, unemployed, immigrants, they all have exactly the same access to exactly the same treatment. And it's not the NHS special in that way. Most countries have chosen, actually, you know what? Healthcare is a basic human right. Everyone deserves it.
You need to mark of a civilised society that you care for people when they get unwell.
And, you know, the thing is, I don't want to go there. I want to go to how it was 10 years ago. Thank you very much.
Yeah,
Great then.
It's an efficient system.
Exactly.
And would we handle the winter crisis now if we were 10 years ago? Yeah, we would.
Yeah, of course
we would. We would be okay.
We've always had winter. You know, it's not a new thing.
I think also probably the pandemic probably helps their narrative a little bit as well, perhaps.
Yeah, absolutely. And I remember that winter so clearly beforehand, how bad that winter was. Remember, you know, we talk about that case recently, but do you remember that case in the 2019 election of that little boy being left on the floor in the hospital?
He had the drip.
Do you remember that?
Sleeping
that
on the
was.
train,
I remember, you know. We had trolleys lining the corridors in 2019.
Absolutely.
This was all before
we were
COVID.
screaming about it at the time,
Yeah, we was, and actually, this is what I find frustrating. Like sometimes I'm like, I get a bit sort of because I've been, you know, we've been speaking up about this for years. We've been and we have been. Both of us are pretty Larry on social media, and we've been talking about this for health workers have been talking about this for years, and we just keep getting ignored. And everyone was saying, look, if we have a pandemic or if there's going to be an increase in admissions, the hospitals will really struggle. And we saw that happen in COVID, and a lot of things.
What actually happened was the government made the choice. Now you won't believe this. Honestly, some folk don't even understand what happened when the pandemic hit. The government shrunk the NHS by 8%. So we had up to 35% more admissions than we would normally.
Because they'd closed it off for operations and...
So initially for social distancing, they shrunk it by 8%. And some countries did shrink it a little bit to start with, but within a month or two, it was beyond. So they had said, well, we're going to have 10 to 20% more patients. We need that capacity. The UK government, in England at least, kept it shrunk by almost 8%, 6% for 2 years. We're now 1% up, and we've got a 10% increase in demand from just COVID just now. So what's going to happen? Their policy was, here comes COVID, ration healthcare.
Wow.
And right now we're in a rationed healthcare, extreme rationing of healthcare, and I think people need to realise that what we're doing just now is you phone for an ambulance, we're rationing that. Whereas 10 years ago, we wouldn't. You get it like that. We're having to ration care. And that's a choice that they made, and they didn't need to by the decisions they made.
And the consequences, people are choosing to go private. Like, I actually work in quite a deprived part of London, and even my patients who just can't afford it.
They'll borrow the money, if you're in agony and you're debilitated.
They're being forced to. And then what happens is that, you know, the sort of the ethos that we have in this country of sharing risk and all in it together, that starts to disintegrate. And that's very worrying, because when people start to then using private healthcare, they think, well, why should I pay into it? If I went private, why am I paying for someone else to have it? And then it all starts to disravel, and that's really concerning.
You can see it all, you can see it all happening.
And the hilarious part is, it's not hilarious at all, it's tragic, that they're not going to give us a refund on our NI or our tax. We'll just be paying private. We'll be paying double.
I agree.
How much are they paying? They pay 3 times the amount in the US than we do for healthcare. And they have worse outcomes. We're going that way. In England, anyway.
Ordinary
You're
waste.
so right. They wouldn't be like, here's some tax back, because that's not going towards the NHS anymore. Of course they wouldn't.
Well, look, there's a new PPE contract or a new tech contract.
Oh, that my mate, who's never made anything in their life, they can have it. Wonderful. Well done. On that note, talking of that, let's end on something which is tragi-comic.
Okay.
Matt Hancock
Oh my God.
You're delighted to see that he's going into I'm a
What
Celeb.
is he doing?
I mean, just to add insult to injury after everything that we've spoken about.
It's the book that gets me.
You've got a
He did so well, he wrote a book. Do you know what I mean? I mean, that's just
book
unbelievable.
on how to fail.
There's a tiny part of me that does want to see him covered in insects,
do.
petrified.
Yeah.
You know,
I think
that's
and then
just
just
the
go hang out in-
sadistic.
I'd like that
stay
too,
there.
but I'd also like a by-election.
And I'd also
Yes.
maybe like a pay rise, like in line with inflation.
Yeah.
Yeah.
I think MP's got a pay rise recently.
Yeah, and a by-election would be good as well. Oh, look at me now getting my cards like that. Okay, well, I think that's probably what we're going to take away from this is that I'm looking forward to the next general election because it feels like you've confirmed a lot of things that I maybe thought, but it has been fascinating to hear it from 3 people who are doing such amazing work. So thank you for hanging in there. And the vast majority of Brits are kind and do appreciate
You
it.
know that.
And I think the NHS is incredibly valued, so they can only mess with it so much, hopefully, before people
Get to the streets.
take to the streets. I'm there, I've got my pitchfork, I'm ready. But, you know, I think that's probably what we've got time for tonight. But thank you so much for joining us, and I really hope that you found this conversation enlightening, and I know that I certainly have. There's not going to be an after dark today because we'd better let these fantastic doctors get back to their work or home to rest. They're allowed to rest. But thank you for giving your time tonight. It was so appreciated. Thank you for watching, and don't forget to like, subscribe, share the episode as well. And if you want to support Byline TV, you can do so by becoming a member at byline.tv/join. We don't have billionaire backers, not like the Tories, just you guys, so please help us by becoming a member, and we'll see you next time. Good night.